And questions tonight about the way Fletcher Allen Healthcare handled the case of Peyton Giraud, who died 2 days after visiting the hospital. Good evening, I'm George Mallet.
And I'm Stephanie Gorin. The 14-month-old death was ruled a homicide, although police have yet to charge anyone. Tonight, we take a closer look at what happened before Peyton's death, including a visit to Fletcher Allen Healthcare. And we dig deeper into the requirements medical professionals face when dealing with unusual injuries to children. News Channel 5 WPTZ's Bridget Shanahan has been following this story for us and joins us now with what she's found out. Bridget.
Well, Steph, tonight more questions about Peyton Giraud's death. Those who knew the young victim wonder if the hospital did enough to help the Winooski toddler. And advocates say medical professionals in Vermont need more training when it comes to recognizing and handling cases of potential child abuse.
It was heartbreaking, literally heartbreaking.
Stephanie Bilodeau met Peyton Giraud when he was just 3 months old and saw him nearly every day since then. He was in the same daycare class as her son until Peyton died in early April. He was just 14 months old.
And when I found out, I just broke down.
According to court documents police filed, Peyton visited Fletcher Allen Healthcare 2 days before his death. Medical staff observed bruises on each side of Peyton's neck. When asked, neither Peyton's mother, Natasha LaForce, nor her boyfriend, Tyler Chicoine, could explain how Peyton received the bruising on his neck. Doctors also told investigators the child was being treated for throwing up, a fever, and malaise, which means being generally out of sorts. According to the Mayo Clinic's website, 2 of Peyton's symptoms, both the vomiting and the disorientation, are symptoms of children with head injuries. However, those police documents filed with the court make no mention of doctors discovering a head injury. The medical examiner, though, would later rule that Peyton died from trauma to the head and neck.
He should have been not released to his mother that day.
According to the chief medical officer at Fletcher Allen, Dr. Stephen Leffler, a doctor could hold a child and call DCF or even police if they thought that child was in danger. But in Peyton's case, that's not what happened.
We have protocols in place to let the department, DCF, know if there have been issues. And we make a determination if it's safe for them to go see the patient in follow-up as an outpatient or if the patient would need to stay in the hospital.
DCF was notified, but the young boy was allowed to go back to his Winooski apartment with his mother and her boyfriend.
And had they looked into it a little bit more, they may have found that, maybe he went to the hospital because he was dying. You know what I mean? And I think that if they had looked into it further, they probably could have saved his life.
Would a suspicious situation like that, where there's bruising on the neck, which isn't a normal injury that a young child would have, and the combination of the parents having no explanation for that, would that be enough to warrant maybe more testing to see if there are other injuries that aren't visible?
I see it as 2 separate questions. There's a question of, does this injury that you're seeing in front of you make you worried potentially about child abuse? That's one question the provider needs to deal with. And then, based on the exam that you're doing on this person right now, in your expert opinion, are there other injuries you're worried about managing right now?
But it's all a judgment call, right?
Exactly.
Jennifer Pullman is the executive director of the Vermont Children's Alliance, and she points out medical professionals in the state of Vermont are not required to go through any training when it comes to identifying child abuse.
We need to provide more support and training for our medical professionals, and we also need, in terms of helping them to identify symptoms and signs of abuse.
Now, although Fletcher Allen employees are not required to by the state, they do go through child abuse training every 2 years. Police have not charged anyone in connection with Peyton's death, although LaForce and her boyfriend are both in custody on parole and probation violations, respectively. That's unrelated to the child's death. Bridget Shanahan, News Channel 5.